Hello, welcome to any community. In this particular video, we are going to know about the method of listening to the patient. So, whenever we are speaking about, there is a huge difference between hearing the patient and listening to the patient. So, in this particular video, we are going to know about the benefits of listening to the patient in the diagnosis of the disease as such. So, when you think about the method of listening to the patient, first of all, we need to know about why we need to listen to the patient properly. What are the different benefits of it? So the main primary benefit to understand the nature of the disease in the diseased individual, whether the person is suffering from cerebrovascular accident and or whether the person is suffering from the osteoarthritis of the patient, osteoarthritis of the knee, etc. So that in that particular sense, as per the our understanding, whether the person is suffering from tamakashwasa or whether the person is suffering from kushtha or whether the person is suffering from the visarpa or vatarakta, in that way, the nature of the disease can be identified if you are listening to the patient accurately. The first and foremost thing regarding the benefits of it, other side benefits, what we can say, that is improving the communication as such. That is basically communications are verbal and non-verbal communications, wherein the verbal communication is identifiable by almost all the individuals. As far as percentage of the verbal communication among the 100% of communication is only up to 7%, whereas 93% of the communication are considered to be non-verbal communication. In that, the certain aspects such as the tone of the voice or otherwise the body language of an individual, that is how the person is having the movement of the hand or how he has kept his lower limb and what is the position of his eyes or the face or the lips, etc. Based on that, we can give the or we can understand many of the informations as such. So that is, we can able to identify what the person is having inside him. It can be identified by the listening to the patient accurately. So that is body language, as we have discussed earlier. The nature of the body parts positioning will be helping us in diagnosing the disease accurately. Suppose if the person is always keeping the head low, one of the reason may be the person may be having the depressive mood as such. In that way, the body language can be identified. Identifying patient needs. What are the needs of the patient? Whether the person is suffering from very severe pain, the first and foremost need of the patient will be getting relief from the pain. Or the person is suffering from the huge abdominal swelling, the patient need may be to reduce the abdominal girth as such. So that is what is the patient needs as such. Or otherwise patient is not in a position to walk properly, the immediate patient need may be to walk in the uh, walk either with the help or without the help as such. So that is the identifying the patient's needs are very very important. Predicting the intervention outcome. Intervention refers to the giving the treatment. Suppose if the person is taking the vamana, we know that the person who is suffering from kapha dominant disease, we are going to administer vamana. So the predicting the intervention outcome, that means we are going to observe the kapha shamana effect. So that means there may be the possibility of reduction in the Agni Sadhana Prase Kalasya Gaurvam, Shvaitya Shaitya Shratangatvam Shwasaka Sati Nidrata. So these are the different aspects that may be getting relieved if the what do you say that the Vamana is being administered. Personalized care. So that is what we can say the patient-centered approach can be planned. This is because whenever the person is coming to you, the diagnosis is considered to be personalized, that is patient specific. So that means depending upon the nature of the exposure to etiological factor, depending upon the nature of the effect of these etiological factors towards that particular individual, so that may be individualistic. So that means if you have to give the proper cure or care to the patient, we have to listen to each and every aspect of these presenting complaint or discomfort as such. If you are able to eliminate or alleviate these different symptoms, then we may be in a better position to give utmost individualistic care to the patient as such. And regarding the cultural sensitivity, that means there are specific customs or religious aspects or rituals they are being followed in a particular locality or in a particular community or in a particular society or in a particular family itself. So that will be those cultural sensitivity parts has to be taken care of. That means these are responsible for the emotional uplift in that particular situation. So the listening to the patient is considered to be very, very important. Managing difficult situations, in the sense when the person is suffering from the serious life threatening disease as such, or when the person is near the deathbed, or what we can say moribund situation. In that particular situation we have to what do you say that manage that. We have to listen to the patient or patient relatives. Emotional disturbances, to identify the actual emotional disturbance in an individual. Suppose if the person is suffering from serious cardiac or serious disease as such, so he may be emotionally disturbed. Maybe he may be having the crying face or maybe in a gloomy face, etc. etc. For that, to identify those emotional aspects, whether they are aligning with the patient's words, that may be helpful in diagnosing disease properly. Building the trust and rapport. This is considered to be the another major aspect as far as the listening to the patient is concerned. If you are having the proper trust or rapport, the patient may reveal some of the even the very personal the problems, such as their the sexual health or the regarding their intimate relationships with the family members, etc. So they are going to reveal. And the major aspect, that is undivided attention to the patient. If you are giving your undivided attention, that's 100% of the attention you are giving to the patient, then we may diagnose the disease at the earliest. So here, these are the little bit benefits what we can observe if you are listening to the patient properly. So here there are two words we need to understand: hearing and listening. What do you mean by hearing? That means hearing is actually something related to his hearing faculty. So that means the person is uttering specific words, and the other person is going to the what do you say that hearing the patient, hearing the words, but the comprehension of those he heard words need not be there. Whereas listening, in the sense, the person is going to say the few words, the other person, whether he is identifying what actually he is saying by looking into his facial expression, by looking into his the other body languages as such, whether they are saying correctly or not, that can be identified. That is the main difference between listening as such. Whereas hearing as such, that occurs when the patient is coming to the clinic and he starts to speak the words as such. Whereas listening, in the sense, even when the person is near the door of your clinic or hospital, we can able to make the diagnosis in some of the situations. So that is the main word, what is it, that the idea of the word meaning listening. So here the there are two people are there in a hospital setup. The doctor is saying the words as such, but the other person is maybe hearing, but listening is not being present in that particular regard. Here there are two images. Look into that. Here you see that the person is giving more stress on the right lower limb but less stress on the left lower limb. This is what we can say antalgic gait. This may be observed in cases of the person who is suffering from the sciatica syndrome, or the person may be suffering from the what do you say that the knee joint pain, or the person may be suffering from any of the what do you say that the disturbances in relation to left lower limb can be predicted. Whereas this is the image, this is the video that is showing the lady is having the circumduction gait. So that is the look into the movement of the right lower limb. It is moving in the semicircular fashion. That is what we can say the circumduction gait. When you are observing this circumduction gait, then it may be indicative of the person is suffering from cerebrovascular accident. That too, it is considered to be hemiplegia, pakshaghata, or in Indian colloquial language is what we can say lakwa. As such, so that is being the if you are listening to the patient properly, then we can able to diagnose the disease at the earliest. So here, look into this particular image. The person, if you are observing this particular the deformities in an individual, that is indicative of the ulnar deviation. So that is, if you see this, this is ulna, and here the deviation of the fingers is happening towards the ulnar area, and you are seeing the subluxation of the metacarpophalangeal joints. Subluxation refers to partial dislocation, and look into these aspects. So that is what we can say the swan neck deformity can be predicted. So this is specifically observed in the patients who are suffering from rheumatoid arthritis. So that is the listening to the patient is you are going to observe overall in an individual so that we can able to make the diagnosis properly. Look into this. If you are observing while walking, if the person is having this particular what do you say that the anxious look as such, that is indicative of the person may be suffering from severe pain as such, or very severe pain, excruciating pain may be considered. So to sum up, there is a huge difference between hearing and listening. The term hearing refers to you are going to hear the words only, but comprehension of those words may not be there. Whereas listening in the sense, we are going to hear the patient's words, plus we are going to even visualize the discomfort observed by the individual, how far he is saying is true to his words that can be matched as such. So that is the term called listening. So in other words, listening is considered to be paying undivided attention, that is 100% of the attention to the patient's words, so that we can make the diagnosis at the short possible amount of time. For example, observing the circumduction gait may help in making the diagnosis of cerebrovascular accident or pakshangat or hemiplegia. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.